This isn't a story about grand hospitals or cutting-edge technology. It's a story born in Gadchiroli, a remote tribal district where healthcare was once miles away. For 4 decades, Doctors Rani and Abhay Bang have stood here, building solutions the world now follows.
It feels like we are just getting started.
And while others came with answers,
we identified questions.
One of the first was about pneumonia, a curable disease taking children's lives.
With no access to healthcare around, we asked mothers if they could tell when their babies were struggling for breath.
That's how they started training women to count breaths, diagnose pneumonia, and treat it with simple antibiotics. Villagers were saving lives without a doctor in sight.
Soon, Gadchiroli was teaching the world how to diagnose and treat pneumonia at home.
Then came women's health, which until then only covered motherhood.
Pregnancy is one part of their story. What about the rest of their lives? 92% of the women suffered from untreated gynecological problems just because no one ever asked.
Her study became the first to bring rural women's health into global focus. And then there was home-based newborn care.
Most babies at that time were born at home, and without access to institutional care, the neonatal death toll was staggering.
So we asked families, what happens after a baby is born? Their answers helped Abhay design the HBNC program, led by trained village women, tested in 39 villages. As a result, newborn deaths fell by 62%.
And the HBNC model became the backbone of India's ASHA program, helping bring India's infant mortality rate down to 37 per 1,000 births.
After all this, you'd think the Bangs might finally rest. Instead, they fought alcoholism with the women of Gadchiroli. They held health assemblies where villagers set the agenda. And finally, their magnum opus.
The local tribal people told us that hospitals were intimidating for them.
They didn't look familiar. How could they trust it with their lives?
So they built Shodhgram, a hospital and research center that feels like their village, a place where science meets trust. Because for the Bangs,
healthcare is not only about saving lives, it's also about empowering people to take care of their own health by themselves.
It's about giving people the power to shape their own lives.
For the Bangs, stopping at almost was never an option.